What is a subdural hematoma? To better our understanding, we have scenarios based on real life events. Jessica Jones, 14 years old, arrived in the emergency room at Children's Healthcare of Atlanta, bleeding from her ears and mouth. Her pupils were dilated, she was close to death. She's here now to explain her story.
I remember it was Halloween and me and my friends were trick-or-treating and we're goofing around a lot. I remember running from house to house and falling 5 feet headfirst onto a concrete drag, slipped into a coma.
Within minutes, she performed an emergency craniotomy, which is a surgical removal of a part of a skull to expose the brain, slicing into Jessica's skull and creating an opening to stop the bleeding.
It might be the loss of life, or maybe the loss of everyday function, to use a spoon or dressing, or to recognize loved ones who she's known all her life.
But surprisingly enough, with the right mentor to help her succeed, she was able to go to Stanford University, 22 years old, at the top of her class.
I wasn't wearing a seatbelt at the time, and because of that, I had to get emergency surgery to relieve the buildup of blood in my skull. Spent a month in rehabilitation therapy during this month. I worked on improving my balance, conditioning, walk, reasoning, and memory.
The bleeding and increased pressure on the brain from a subdural hematoma can be life-threatening. Some subdural hematomas stop and resolve suddenly. Others require surgical drainage, like Jimmy and Jessica.
Symptoms of a subdural hematoma can include headache, confusion, change in behavior, dizziness, weakness, laziness, seizures, and vomiting.
Recently hit your head and started having bad migraines. Don't wait until the next day to go to the doctor.